we could do small chunks. So what's in the budget for the caregivers?
So I'm going to divide the caregivers down into even smaller hunks.
Great.
There's stuff for family caregivers. And those are the people that AARP speaks to the most. And the family caregivers, we have over 600,000 of them here in Wisconsin, and they do all kinds of things. And one of the things they do is they spend money, and they spend money taking care of their loved ones. So in the budget, there is a caregiver tax credit. And the tax credit is about $500. And it's a non-refundable tax credit, which means you only get it if you have some tax liability. And what it does is it reimburses family caregivers for some of the money they spend taking care of their loved ones. There are a lot of things you spend money on that aren't covered by insurance or any other kind of program. So that's one of the big things that's in there. That's a program that's recommended by the governor's task force on caregiving, and it's a project that AARP has been working on for a couple of years. One of the other things for individual family caregivers is the Wisconsin Family Medical Leave Act right now is really helpful if you're caring for somebody with a health condition or you yourself have an acute health condition. But it has never been friendly to people with chronic conditions. So the budget changes that and allows family caregivers who are taking care of people with chronic conditions like Alzheimer's, Parkinson's, stroke residuals, to use the Family Medical Leave Act to go to visits, to discharge planning and things like that. It also expands it so it covers children, grandchildren, and grandparents. There's also the requirement I've talked about to you many a time about hospitals having to educate family caregivers when the person is being discharged from the hospital. And they also have proposed a kind of assessment of family caregivers, not about whether they're doing a good or bad job, but whether they need more help and whether there are programs, because we concentrate on the person needing care. But boy, there's caregiver burnout. There's caregivers being overwhelmed, and there's caregivers that could use a little help themselves. So that's something that's new in the budget. Then the second bucket, if you will, under caregiving is the programs. And, the family caregiver direct support is going to be our number one priority there. The programs are second, and it gives more money to the ADRCs. It allows them to the caregiver support programs have been for people over 60. This expands them. So they start at age 19 and run all the way up to 60. It gives more money to the Alzheimer's support programs. And so there's a training program for guardians. So there's some things that are programs that get more money that eventually get to the family caregivers. There's an awful lot in the budget for the third bucket, which is the paid providers and professional staff, because we all know they're vastly underpaid and they really need lots of help. We're going to support those in the sense that we believe in them, but they have professional organizations and to speak on their behalf. AARP often chooses to go to the place where nobody else is talking for you. Nobody else is speaking for you. So we look at our individual members rather than the categories of professions. So on this one, we are going to work hard for the family caregiver and then for the programs that support the family caregivers.